With more than 99 million people in the United States now fully vaccinated against the coronavirus, Dr. Anthony Fauci expects the country to get, quote, very good control of the virus sometime this year. His optimism comes as Mayor Bill de Blasio, New York City Mayor Bill de Blasio, announced plans yesterday for this city to fully reopen on July 1st. Nearly 3 million people in the Big Apple are now fully vaccinated, and about 1/3 across the state are inoculated. Meanwhile, Moderna says it is testing a new version of its COVID vaccine that would not need to be stored in ultra-cold facilities. The move could help less wealthy countries with limited freezer capabilities. The company is also studying 3 new versions of its vaccine to address mutations of the virus, including one first identified in South Africa. Let us bring in Dr. Bob Lahita for some medical insight. He is the director of the Institute for Autoimmune Diseases at St. Joseph Health and a professor of medicine at New York Medical College. So, Dr. Bob, cities like New York City here are planning to completely reopen by this summer. I know many of us here are looking forward to that. Let's talk about how important this would be. And while this might be good for the economy, with only 30% of the U.S. population vaccinated, do you still agree it's a good idea from a medical perspective?
From a medical perspective, Vlad, it is a good idea, mainly because we are really approaching herd immunity. And the people we're seeing that are sick now are the unvaccinated. And this is a push to make vaccinations really soar in the next 2 months. We have to be very, very mindful of the fact that herd immunity is around the corner. And I think we expect by the end of August that about 70% or maybe more will be immunized in our country. Once herd immunity is reached, then all bets are off on people dying and people getting seriously ill. But they do need to be vaccinated. We're going to have this virus around, Vlad, forever. It's not going away. And so if you don't get vaccinated, it's basically like rolling the dice. When you go to a restaurant or you go to a closed ball game or to a concert, you never know. But if you're vaccinated, as the CDC said last week, you could take your masks off outside, and you could even take your masks off if you're with vaccinated folks in a restaurant.
Love it.
So then you probably agree with White House Chief Medical Advisor Dr. Anthony Fauci when he said the U.S. is set to get control of the virus sometime this year. What sort of factors are playing into that assessment?
That assessment, he is talking about the continuance of vaccination. We got that 20% of the American population doesn't want to even go near a vaccine. There are many healthcare workers that are afraid of the vaccine. He is saying that if you can get one of these vaccines, either the Moderna, the Pfizer, or the J&J vaccine, you have a very good chance in your area and around the country of establishing herd immunity. And if herd immunity comes forth, it'll be like the polio vaccine, when polio just disappeared back in the 50s and early 60s. So we're hoping for this. And I think Tony Fauci sees this as happening in the near future. The worry, Anne-Marie, is all of these variants that we're hearing about and these spikes we're seeing in places like Michigan and in the far west, like Washington State and Alaska.
So, Dr. Bob, speaking on that, Anne-Marie and I were just talking in the commercial break. I wonder if what we're seeing in India could have ramifications for us here in the United States. And the reason I wonder that is because I recall all of us talking about COVID-19 when we were only hearing about a couple of cases in China in early 2020. And, there was some trepidation, but for the most part, most of us were, walking around thinking, well, we feel bad for what's happening in China. We feel bad for the people that are being infected, but we're so far away and, it can't possibly have any effect on us. I worry, I wonder if in the medical community there is some concern that what is happening in India could be a possible vector for us here, specifically if whatever is happening there is a variant of the COVID-19 virus, and that maybe our vaccines, like I'm fully vaccinated, I wonder if that will be enough to protect me in the future from a new variant.
So let me take that question apart. First of all, the vaccines that we have currently will protect us against 95% of the variants. We talk about neutralizing antibody, but I've repeatedly said that we have cellular immunity, which means we have T cells in our bodies that recognize the COVID virus and all of its variants. And the variants really, Vlad, think about this. It's really the spike protein that changes its shape. It can change stereochemically its shape so that the antibody may not fit perfectly well on that. But that's only the antibody. The T cells and the cells of your body recognize the virus, and they say, this is COVID, we don't want it, and they reject it. Natural killer cells come in and reject the virus. So the variants in India are of concern, naturally. But I think we are fairly well protected. The photographs that I had seen before the India pandemic exploded was of people not wearing masks, not socially distancing. There was a religious festival, I remember, in the city of Varanasi, which is on the Ganges, where people were cheek to jowl, no masks, no anything, thousands upon thousands of people who were not mitigating and preventing this virus from spreading. And I think the Indian politicians know this, and they know that that was one of the major reasons for this tremendous surge in deaths and infections. So I'm not really afraid. I am very happy with the vaccines that we have, and I just implore everybody to go out and get vaccinated so that in case these Indian variants do arrive here, if there are such things, that we'll be amply protected.
So speaking of the variants, Moderna is working on multiple versions of its vaccine to address both the viral mutations as well as the storage conditions. We've talked a lot about how challenging the storage conditions are, that these vaccines need to be in sub-zero freezing conditions. Once they're thawed out, they have to be used, in a certain amount of time, which makes it very difficult for more rural areas, countries around the world that don't have the option to refrigerate, but also even here, we talked about yesterday in Philadelphia, they were at risk, and I don't know what the result was, but of throwing out 3,000 vaccines because they were ready to go and no one was showing up to get them. But I want to ask you, your take on what Moderna's doing, and it looks like some of these other pharmaceutical companies are also sort of going to be working to update their vaccines. It seems like kind of on an ongoing basis. What do you make of this?
Yeah, well, Anne-Marie, it's storage and it's efficacy. We know that RNA as a molecule is extremely delicate. I used to work in the lab with RNA, and I had to wear a hairnet and gloves and all sorts of things because RNA is easily digested by enzymes, those chemicals in our bodies that chemically change big molecules. So think of the vaccine as an M&M. The NPR did a beautiful story on this. The M&M is chocolate, that the RNA in the center of the M&M is chocolate, and it's got a sugar coating to prevent the chocolate from melting, particularly in the heat. But you know, and I know, that if you have a handful of M&Ms and it's 95 degrees outside, you're going to have a handful of malted chocolate. And that's exactly what this vaccine is like. So the vaccine has to be protected with a coating, and the coating is fat and protein. And what Moderna is doing, which is, and you can store Moderna vaccine at a little bit lower temperature than the minus 70 degrees for the Pfizer vaccine. So the Moderna people are creating a coating for the nanoparticle, which is so small you can't even see it with a microscope except an electron microscope. They're providing this coating that will protect the RNA, and so it can be stored at a lot warmer temperature. That opens it up to the Southwest, Arizona, New Mexico, Texas, where shortly in the summertime it's going to be very, very warm. And we want to be able to give people efficacious vaccines, which means that they're going to hold their strength as we administer them in very warm temperatures. So this is a great idea. And I think Moderna is a brilliant company, as is Pfizer BioNTech, as is J&J. And they're all trying to really devise a vaccine that is stable and continues to hold its efficacy. That's the most important thing.
Wow, the science that is going to come out of this, it's truly fascinating. Dr. Bob Lahita, thank you.
Thank you, Anne-Marie.